to all those seeking vibrant health. It's Dr. Rachel Northern here, and I'm in my office here in Johnsburg, Illinois. And today I'm presenting my last of the first quarter of the year series on hormones, on endocrine system. And the first one I did was on adrenals and the HP axis, the hypothalamus and pituitary axis. This one I'm doing on female hormones, and last month I did thyroid. So I do have all my videos on my YouTube channel, which you can reference at the end of this talk. I have that reference for that. So this is what we're talking about, balancing female hormones. I am going to tell you this is just a short little taste of maybe some things to think about. This is very complicated, and systems, all the endocrine systems is kind of crazy and complicated. So we're just going to overview, maybe give you something to think about, some things you can change. So here we go here. Again, like I said, we talked about thyroid. These all work together. So the hormone system is like an orchestra, and there's a lot going on and moving parts. So first off, today we're going to talk about some quick facts about hormones. People really don't know what they are, and what's the causes of hormonal imbalances, and some causes, what we should be cautious about, and what are your symptoms if you have some problems with hormone imbalance. That could be maybe what's going on with you, and then particularly how we, as a chiropractic holistic practitioner, how we kind of address these things and help people with these issues. So first off, who am I? Who am I to talk about this topic? I get this a lot. I just literally a couple nights ago went to a roundtable discussion. I was the only chiropractor there. It was like 18 nurse practitioners, with a nurse practitioner leading the talk about particularly this thyroid, actually, she was talking about. And so people are like, why is the chiropractor here? I get that a lot when I go to some of these functional medicine training. Me personally, I have a passion for the whole body optimal health. And, chiropractic in general, we definitely want to focus on the optimal nervous system function, but also the overall, body. How is it functioning? It's nice that we can adjust the spine, we can get rid of pain, we can we do get changes in some of the functional things, but there's a little bit more to that picture. And I like to help people, become as healthy, as vibrantly healthy, as my book talks about, that vibrant journey. And I want people to be as healthy as possible. So that's why my passion is chiropractic, and then nutrition and all these other components. And between those two, people can thrive and not just survive. And so I love that. I personally, I've been in practice 21 years, and pretty much all my continuing education has been in pretty much nutritional supplement theories, functional medicine stuff. So I have a passion for these things. And so that's, a little bit I do technique seminars, but most of the time I'm mostly focusing on all these other aspects of human health and how the body is amazing and how it can heal itself. I am certified in Webster technique, which is a pregnancy technique to make sure to balance the female pelvis, which just does help with hormone balancing, making sure those nerves are communicating, making sure that you have proper contractions when you do finally have the baby, but also as the baby grows, making sure the communication is good to that baby. And then I also have my pediatric certification to help with the babies and the newborns after they give birth and then on. And I just love treating everybody in between. I don't just like seniors or 40-year-old women that come into me. I like everybody in between, so not just female hormones, female aged people, but so let's see here. And my recent thing is, so talking about this topic, is I personally am going through perimenopause right now, and I had some symptoms that my patients have talked about that I never experienced before. And I went through like the insomnia and the night sweats and like crazy thoughts and whatever, and stress and all these things. And I was like, what is this? What is going on? And so I was like, okay. And I knew I recommended certain things for patients, and they said, oh, that works for me. And I go, okay, great. And I literally, doctoring myself, did one thing and it didn't work, and I did another thing and it didn't work, and I did another thing and it didn't work, and I was like, this is driving me crazy. This is crazy. It always works for all my patients. And then it was like the last thing on my list to try from all my education, and I finally found something that worked for me. So one size does not fit all. We'll reiterate that. When you're talking about balancing the body, there's not one treatment particularly. We are all individual, and especially with hormones, they are so quite unique with each individual, and your lifestyle depends on it. There's a lot of factors, which we're kind of going to go into. So I personally am a patient too. You know, I have this journey, and unfortunately, female hormones are really not discussed really on the preventative side much. They're talked about maybe putting on put you on a hormone or put you on birth control or try to give you things, but there's not really people about what you can do for yourself. So we're going to talk some about that. So, you know, facts about hormones, again, we have them all the time. They're the chemical messengers to keep our body functioning, you know, between our brain and our organs. It's just constantly going on. There's constantly looking for balance. So we have these chemical messengers, and you know, some people are more sensitive on some hormones and then others. And you know, we have internal and external factors that are going on all the time. And so we want to make sure we try to get it in balance. So unfortunately, when people talk about hormones, I always think oh, she's hormonal. Well, we're hormonal all the time. So that's a really bad statement. It's like that you're saying your hormones are not acting right. They're not in proper balance. They're not communicating like they should. So we have some that are supposed to be amped up at certain times and amped down at certain times. You know, the cycle just in a day-to-day basis between sleeping and being awake and certain times of the day and where we're supposed to be. And there's just a lot of changes going on. And particularly for females, we have that then going, if you're cycling, going on through a month. You have sometimes that you have higher hormones, sometimes you have lower hormones. It depends on what cycle you are. Or if you're going through puberty, as we know, that junior high age girl is usually something to deal with. So because those hormones are starting to ramp up and trying to change things for them to develop what they need to develop into through puberty and be healthier in that. So we want to make sure that these are doing what they're properly done. So again, we're going back to what are hormones, and you know, people don't think about insulin being a hormone. Well, insulin is, you know, another thing released from the liver that helps us, you know, take in our sugar. People don't think about all these different things and where they come from. So right now in our society, we have an attack on cholesterol. I hear this almost on a weekly basis. My doctor says my cholesterol is too high. And that's definitely, we don't want it too far out of range. I'm have a different range that I like cholesterol being in. I think the labs that some of the mainstream traditional medicine have that level low. And the reason why I really want to stress is because cholesterol, I have the visual presentation here. If you're listening, you can try to watch the video, but on the screen here, I have what the base molecule of cholesterol. You can look it up. I Googled this myself, looked up the base. What does the image of that cholesterol, like the base stick fingers, back to organic chemistry and all these bonds. But if you look at the cholesterol molecule compared to cortisol, which is the one we talked about with the adrenals release. And then right here, over here, is actually progesterone. If you look, they're all based off of cholesterol. So most of our hormones, majority of our hormones are based off a cholesterol molecule. And unfortunately, if you actually have too low cholesterol, you're going to struggle with these hormones. If you don't have the base things, needs, you don't have the fuel. So cholesterol is super important, and they don't talk about the importance of cholesterol. And so for me, as a holistic practitioner, when I'm seeing like so many people with high cholesterol, we have more stress in our society than we've ever had, I believe. You know, we're post-COVID era, we have all kinds of inflation, all kinds of things going on in our world, and we have more stress than ever. Not just, mental stress, but all the toxins that we're exposed to. So we're going to talk a little bit about that. But cholesterol is really important. So if you're feeling like, you're, getting attacked on how high your cholesterol, please talk to more of a holistic practitioner and make sure that what is right for you. Yes, they attack the cholesterol because they think about, like, when they see corroded, like artery thickening, when you see like the clogging of the arteries, they will see the cholesterol in there. but cholesterol is actually like a soother. It's like soothing. So just like when you scratch yourself and you develop a scab that's supposed to protect that scab, cholesterol is like that scab. So it's really a protector. The reason why it's there though is because of inflammation in the valves. So if you address the actual cause of the scab, why cholesterol accumulates there, and that's mostly, again, related back to lifestyle, related back to other factors. If you address that cause, you don't have to worry about the level of cholesterol. So we want to go back to the why. As a holistic practitioner, we always go, why is it doing this? But why is it doing this? We want to see that, because attacking just cholesterol itself is not a great thing, because like I said, we need this for all our hormones to be produced. And we're going to actually show that. It starts in the brain. The brain tells us what to do with the cholesterol. It tells us, goes down, and says what we need to manufacture. And we have some scans on that. So here's this, this is just little stick drawing all our sex hormones particularly. And so you have your DHEA, you have your progesterone, your estrogen, all the different estrogens, testosterone, and cholesterol is up here. Cholesterol comes from these. All these little words in between all these different hormones that are manufactured in our body is enzymes. So where's this conversion happening? So this conversion happens usually in the liver or other places that we're digesting things. So we want to make sure we have the proper nutrients to make these things, and make sure we have the proper enzymes so we can break our hormones properly. So here's another chart just talking about all these. These are just abbreviations of all these different hormones that are produced in our brain. The hypothalamus is that one top thing in our brain above our pituitary gland. So part of the brain makes all these different hormones, goes to the pituitary gland. The pituitary gland communicates what to do with it. There's two parts, front and back of the anterior, posterior pituitary glands, that creates more hormones to then talk to our sex organs, our adrenal glands, our thyroid, mammillary if you're female, our liver. So again, our liver, our pancreas, and our kidneys, and then other parts of our body. So we want to make sure we're getting all this happening in our body, making sure we have healthy pathways going on, make sure we don't have anything interrupting these pathways. So, what are some of the hormones that we have? We have like over 50, tons of hormones going on. Some have little tiny things that they do. Some have big things they do. And some of the hormones, I remember back 23, 24 years ago, when I was sitting in endocrinology class, I remember seeing, we'd say, okay, this hormone, either let's say follicle stimulating hormone, which is supposed to stimulate your follicle to develop, release your egg. It was like, it would say, this is the primary function of it. And then it had like 3 other functions that this hormone did. There was never like a cut, like this is what it does and this is all it does. It was always like little secondary, little side gigs that it had too, how it influenced the body. So one hormone can do a lot of things. Maybe we always think of it as one thing, but they all do something. They all can kind of cover for each other if they need to, like a backup. So the main things people that get pressed nowadays, the cortisol, DHEA, which the adrenals I talked about in my first talk, insulin, which is actually produced in our pancreas. That's, again, how we help with sugar handling. We have the estrogens, which we have 3 different ones. Some are more potent than others. And then we have our progesterone, our testosterone, and then we also have our thyroid hormones that are produced, which we talked about last month. So, they're all this whole body. It's a whole body system that communicates. So, and again, we already talked about everybody's different, have different amounts and different ways they manifest in their body. So, we have a general consensus of how everybody should be running, but like I said, everybody's maybe a little bit differently. So, hormones aren't bad. So like I was just saying, you say somebody's hormonal, it's not necessarily like we're bad. They just have to be in that proper ratio and proper function for you. So we don't want them out of balance. So example here is just talking about glucose and insulin. If we have it too high, it's going to give you a risk of diabetes. If we have it too low, then you're having hypoglycemia. So you've got to make sure you're in that right dialed ratio. So you're getting that just right amount of sugar into your blood cells, right amount of things to make sure you're not too high or too low. So that's, if you go too high for too long, then the cells start to say, oh, stop, I don't need the sugar anymore, and then it stops responding, and then they'll cause a dive, and you don't have all these rebounds happening. Or then the liver goes, oh, all the sugar's here, let's push it to fat because we don't need all the sugar, and so that's why some people can't lose weight. So, because the body thinks it's not producing the sugar properly, and then rearranging that. So, so for another example is if you have too high estrogen, we can have, first of all, we need it, if we need it for our brain, we need it for our bones, we need it for the reproductive system. Right now we have like an epidemic on infertility. So that's a lot of this is the estrogen and progesterones are not in the proper ratios. So they're having that. And then if it's not in the proper ratios, we can have osteoporosis, PMS, all these symptoms that everybody talks about. Endometriosis is a big problem in our society, and that's generally actually too much estrogen. What happens with that is so much estrogen is bathing in your body and your bloodstream that other organs are like, have receptors. Like I said, all these hormones go everywhere. And so some of the cells are like, oh, I'm getting estrogen, I must be the uterus, so I'm going to produce uterine tissue, and it's nowhere near where the uterus is, and it starts producing these weird cells that aren't supposed to be there, and it causes irritation and problems. So common symptoms most people know: fatigue, weight gain, trouble losing weight, either tired and wired, trouble falling asleep, staying asleep is another one. Obviously menstrual cycles, inconsistent cycles, emotional before your cycle, or you want to emotionally eat, you want to look for some endorphin releases, low libido, sex drive. We have, the oily skin. A lot of times you see that too when the girls are having the breakouts, the post-puberty, itchy. Sometimes you can get hair loss. That's kind of sometimes more related to thyroid, but it can be with our sex hormones too, if those are out of balance. GI stuff. That's sometimes as a PMS syndrome, or the PMS syndrome, when they have like gassiness, trouble with digestion. Obviously you can have anxiety, mood swings, depression. So, panic attacks. We talked about infertility. This is one too people don't think about, is the race. You can get the racing heart. That's also related to thyroid a lot too. Sometimes people, they know a certain part of their cycle, they kind of have these palpitations. So it's telling me things aren't kind of correlating right. Like either your estrogen, progesterone is not balanced and not going through the cycle properly. So that can cause actually palpitations and irregular heart. Like I talked about hot flashes and night sweats. That's kind of more closer to like that perimenopause, when those hormones are starting to phase out into mature womanhood, and we no longer need those organs for baby making. And so they're kind of trying to phase out, and those hormones are trying to dive down, but the body's like it's not doing it properly and gradually. So, brain fog, memory, burnout. So unfortunately, this is pretty much all of our society. So if someone comes in and they have these symptoms, it could be, it could be adrenal fatigue, it could be hormonal imbalance, it could be thyroid. So that's what the part of a holistic practitioner is, to try to see, okay, what is kind of your primary, what's like kind of like the smoking gun. And sometimes it's not just one gun, it's like a cascade of problems, and we kind of have to address the biggest one and then work our way backwards into getting more in balance and healthy. Unfortunately, these are caused by a number of problems, and I wish there was that one size fits all. I love being a chiropractor. I love the simplicity of chiropractic, that all I have to do is evaluate which bone's misaligned and subluxated, and I put it back into place, and I can do that effectively, and I can see post-word that I did it properly and everything, the nervous system's communicating better again. But I cannot see how look inside someone and see if their hormones are fine-tuned properly. I cannot see these things. I can't. It's not an immediate thing. So it's a trial and error, and especially for women, And don't get me wrong, I've talked mostly about women through this, but men have the issues too. Sometimes men have these kind of PMS things, and menopause, so they can go through these issues too. We definitely have some dropping of testosterone with a lot of men earlier than traditional, like in the years and years. Now we're getting more low T, and so there is issues with men too. So I don't want to just pigeonhole you guys, but there's a different way for us to try to evaluate. And one thing is, evaluate like what's your stressors, what's going on mentally, what's going on, what is your work like, what kind of activities are you doing. So exercise does play a role. Like, are you moving your body? So I think they came out with, like, I think you're supposed to do 10 to 15,000 steps a day, and the average person does like 5 or 6,000, if that. So that is something that we're definitely under moving. So we need that circulation. We need movement of our body. Are you also, sleeping? Are you staying up on blue screens? Are you watching TV all the way through the night or into wee hours? Or are you making sure to turn off the TV, turn off that blue light exposure into the brain, and make sure that brain is getting the rest it needs to restart? Because like we talked about in the beginning, the chemicals start in the brain. We need to make sure we're treating that brain healthy and giving it what it's needs. Are you like a sugar carbaholic? Are you constantly feeding that body things and just causing this load of sugar and things, which high sugar actually causes that imbalance of cholesterol and healthy cholesterol. So what are you doing with your sugar? What's going on with your diet? Also inflammatory, that sugar is inflammatory, inflammatory issues, but infections, illnesses, chronic illnesses. We have all kinds of viral infections going around lately, more so I swear than we've had in the past. So is your immune system depleted? Are you taking care of your immune system, doing things that you need to, taking supplements and nutrients to help make sure you're supporting your immune system? Gut, and we talked about this with the thyroid one. Gut is really important of just processing some of these nutrients that we need for the hormones. Are we absorbing our manganese, for example? Like, that needs proper gallbladder support to actually absorb manganese. Manganese is really important for our ligament strength and our tendon strength and some of our connective tissue. So that's just one simple cascade I can talk about. So what's going on with your gut? If your gut's totally a mess, if you have a leaky gut, if you have bad bacteria in there, which most is another common thing in society, then that's going to interfere with your hormones as well. And then toxins. So I'm listening to, I like Audible, and I mostly listen to a lot of my books. I'm listening to a book called Sicker, Fatter, Poorer by Dr. Leonardo, something like that. But it is Sicker, Fatter, Poorer. And he's just talking about endocrine disruption and about all the chemicals in our society that's just blatantly out there, like in plastics and all that. And if you want to read where some of this is coming from, if you don't believe toxins there is no toxins affecting us, this book goes into it and how, as a society, we need to work on that and trying to eliminate our toxic exposure. So it's pretty fascinating stuff. And then a lot of us in our society are on medications, and sometimes just people think also the over-the-counter medications it's okay because it's, you don't need a prescription for it. Taking it over counter is not going to have effect on you, and it does have effect on you. It does cause problems. It causes problems in the liver, causes problems in the body. So pay attention to what you're actually putting into your body, what you're putting on your body. So let's see. So I've had a lot of people that know they're just not right. Like, they go to the doctor and they're told they're normal. Like, that's normal for your age. Even when I went to that round table a couple of days ago, they're talking about, well, some things are okay, like acceptable limits. They were talking most about the traditional medicine, saying how that they're like, well, that's everybody. Most people have these symptoms, so that makes it okay. And as you've heard me talk before, Just because everybody's sick doesn't make it okay. Just because it's average or everybody's like that doesn't make it right. So I want people to be above average. I want them to be healthier and optimally healthier, not just getting by. So, that's just to be expected is not good with me. I'm not working with patients. I want people healthy. So, like I said before, in this office, one size doesn't fit all. And it's going to take time, especially like I was saying, for females, because it's like a cycle and all the changes going on in 1 month. It's going to take multiple months to start to see really true change. Now, we can get some symptoms managed a lot of times sooner than later, but overall, it's a process. In my office here, like I don't really go crazy. I'm like not like an endocrine specialist. I'm not like autoimmune or any of those things. I'm more of like, if you are just feeling slightly off, you want more wellness, that's my niche. I want you to get there. If you're a more complicated system and complicated problem, I'm going to send you off to like those holistic nurse practitioners or functional medicine people, because they're better equipped to make sure you're getting the proper treatment, and they can prescribe something that I necessarily can't prescribe. I'm more of like, if you're just feeling, something's not right, but you're overall, fair, you don't have any major things going on, I'm going to try to get you to move that dial and get you just feeling better, operating better. So I know my niche. I know I do have people that come in that just have, these complicated problems, and I do my chiropractic part, and then they work with the other functional doctors to make sure they get that part. So we do as a team. So sometimes I know I'm not the end all be all, but I want you to know this information's out there, that there's help there. But in the office, I have, help people. I understand, it's can be overwhelming. There's so much data out there on this stuff. So I can try to help you get you navigated to the right place. I want to make sure your nervous system's proper. I did mention that to the nurse practitioners about how structure does make a difference. And if your nervous system's out of alignment and not communicating properly, then you can throw all the medications and all the supplements and herbs at it you want, and it's not going to make that much a difference if you can't address that. So they did work with chiropractor. The one that was talking up front does work with chiropractors and acupuncturists. So let's see how do I do this? I go more progressive, personalized. I'm a more personalized person on looking at the individual. I don't look at the papers per se, the labs that people come in. I do look at them, but I want to look at what's going on in the overall picture. So I look at, nutrition and symptom surveys. I like hair analysis because that gives me mineral profiles and see if you have any heavy metals going on. We just started re-engaging in saliva tests for people who want to see what's going on with their cortisol, their estrogen, and testosterone and all that. So we can do that testing as a chiropractor. And how I address that is generally, making sure your spine is clear of subluxation, make sure that nervous system's working. I make sure, then we kind of talk about different herbs and supplements we can help you with. But also I talk about lifestyle, things you can do lifestyle, like adapting that low carb Mediterranean diet, which is more lots of green leafies, eliminate the refined carbs. So more of your wild rice, your long grain rice, you're eliminating mostly the glutens, cold water fish, your avocados, olive oil, all these things that are just healthy overall and just very supportive of the body. And the low carb Mediterranean diet has been the one. Every time I go to a seminar, even a couple months ago, they said that is the one diet that in all research that says is good for the body. No matter what they're studying, that is the one that always comes up on top. It's really good. So that is the one I recommend. And eliminating those sugars, like we talked about, they're just not good for you. And then, like I talked about, try to move as much as you can. I'm not necessarily saying everybody has a cookie cutter way of weight loss, or to lose weight. But you have to move your body and you have to eat properly. When you eat properly, that helps a lot of this go away. So let's see what else. And And then what's nice about the office here is we're all kind of on the same mindset. We have a great team support. You can always call and talk to even my front desk. They're, you know, they know these things too. They do try to practice these things. We're leading up to every spring. We do spring and fall. We do the purification and detox, which really totally resets you and gets rid of the sugar and the caffeine and all the junk. And you realize how much that alone, I've had people, their PMS goes away. You know, they lose weight, they get pregnant. I've heard of people just doing these things just to reset our body and treat it properly. So the other last thing we just started doing is some of this DNA testing. Like the book I mentioned earlier, it's just talking about this epigenetics and about how these chemicals have affected our genes. So sometimes you want to see what pitfalls are going on in your gene system. So that's like just a cheek swab that we started recently to do, which is really nice to kind of just see what are you prone to, what is your default. I personally know I can't do gluten. Gluten and I are not cool, and it showed up in my genes. Caffeine and I can only do like 100 milligrams of caffeine. Over that, then I get palpitation and have problems. That came up in my gene. So there's these things we can kind of figure out without having to go through expensive tests, which is nice about the DNA testing is like it's one and done. That's you. So those are kind of little pitfalls that are kind of nice to help us navigate through the system too. So let's see. If you want, you know, to help more information, we do have the surveys. If you're wanting to do any of the surveys, we can always email those out to you. You can, you know, message us through the Facebook here or email us at thedoctorandyou.com. If you want any of those surveys, if you're patients of mine, you can always ask for those surveys. We can give those to you, kind of get started to get like a consultation to see where we can help you at. Like I said, reach out if you're not around me. Reach out to some of these functional medicine nurse practitioners, doctors. There's more and more of them coming onto this side of holistic care, which is awesome. And you know, I do have a book called The Journey to Vibrant Health, which is kind of just some of my some of the things I talk about all the time. Just overall, what things you can do to be healthier. I just had a patient read it a couple weeks ago, and she came in yesterday and she's like, I've lost 6 pounds and I'm doing all these things like you suggested there. I'm like, oh, thank you. That's awesome. I was cheer you guys on because I'm just trying to put the data out there. You guys have to do the work. I cannot do the work, all the work. You guys have to do, you know, a lot of the work, but it's so rewarding when you do, and you do feel the difference. So I have lots of videos on my YouTube channel, like over 300, I think, at this point, talking about these things, talking about diet, talking about the detox or purification diet as well. So you can reference those. And that's it. You can always text the office 815-344-0113. Text or call if you're interested in engaging.